In this short revision video, we are going to discuss about drug interactions. Apart from that, this video includes 2 Neetpg recall questions based on your general pharmacology. So let's begin. So the first point we are going to discuss is your microsomal enzyme inducers and inhibitors. So for example, as you know that there are substrates for these microsomal enzymes, and based on that substrate the metabolism takes place. So if there is a microsomal enzyme inducer, so what happens is the drug is metabolized and the active form is in less number, so this causes failure of the drug. Whereas when you inhibit this enzyme, the drug level increases, active form increases, and this leads to toxicity. So we'll discuss this based on a mnemonic which I've got from Dr. Ranjan Patel's MCQ book. So it is grab DJ, so it is grab DJ Priyanka Chopra for enzyme inducers and for inhibitors, and invite her for a quick veg dish. So based on this we are going to remember the enzyme inducers and inhibitors. So enzyme inhibitors include griseofulvin, the antifungal, and rifampicin. So this was the Neetpg 2021 question. So the patient was there who was taken anti-TB treatment, which obviously includes rifampicin, and she was also an oral contraceptives. So when you will give together the oral contraceptive and rifampicin will induce the metabolism of OCPs, and it will cause failure of OCPs, and then the patient might conceive still being on OCPs. So that was the question of Neetpg 2021. The other is alcohol when in chronic usage. Alcohol in chronic usage causes microsomal enzyme induction. The other is benzopyrene, then DDT, then St. John Warts, which is used in the treatment of depression. So in the mnemonic for Priyanka we have phenytoin, phenobarbital, and primidone. So as you know, phenobarbital is the drug, as we have already discussed in our inherited hyperbilirubinemia, that we use this drug as theoretically to induce the enzyme your UDP glucuronidase transferase, and it will decrease the bilirubin and cause more conjugation. The other drugs are, which include carbamazepine. Also to note that carbamazepine is an auto-inducer, so it induces the metabolism of itself as well. And then cigarette smoking. On the other part, we have drugs which are inhibitors, which include quinidine, isoniazid, protease inhibitors. So this is important. So protease inhibitors which are there, they are used in anti-HIV treatment. So in HIV treatment we use ritonavir as a booster. So what it means by the booster is it is going to increase the levels of other protease inhibitors. So we use ritonavir plus lopinavir combination, which will, so ritonavir will inhibit the protease inhibitor metabolism and increase its level, so it will increase. So all protease inhibitors except nelfinavir are given along with ritonavir to enhance its blood levels. Nelfinavir is metabolized by other CYP enzyme, hence it is not used with ritonavir. The other drugs are cimetidine, which is not used now, chloramphenicol, ciprofloxacin. The most potent enzyme inhibitor which is assumed is your ketoconazole, then valproate, erythromycin, also clarithromycin, and the other drugs, then grape juice, and in dish we have DEC, delaverdine, and disulfiram, the aversive agent which is used in alcohol de-addiction therapy. So this is about your drug interactions. The other point is now P-glycoprotein inhibitors. So as you know that, so for example this is the intestinal cell, so you have these P-glycoprotein receptors. So what happens is when the drug comes, so the subsets of these P-glycoprotein, they are taken into the intestinal cell, and this is the form of first pass metabolism. So what happens is the one form of first pass metabolism is P-glycoprotein inhibitors, the other part is your liver metabolism. So when you have P-glycoprotein inhibitor, what is happening is you are decreasing the first pass metabolism. So basically you are again causing toxicity of the drugs. Okay, so we will remember the P-glycoprotein inhibitors by the mnemonic vaccine, which includes verapamil, valbenazine, amiodarone, cyclosporin, itraconazole, nifedipine, erythromycin and clarithromycin. So now we will discuss the other question which was there in Neetpg 2021. So it was given that there is a patient on digoxin and he was also simultaneously on some other drug. So after that you note that the serum levels of digoxin was high in toxic amounts. So which drug was added? So this is other drug which is clarithromycin, which causes inhibition of P-glycoprotein, which is of which the substrate is digoxin. So when you will have clarithromycin or any of the P-glycoprotein inhibitors, you will have high levels or toxic levels of digoxin, which will cause toxicity. Okay, so this was the second question which was there in pharmacology NEET 2021. Okay, now we will discuss about some few miscellaneous drug interactions. So first drug interaction is sofosbuvir and amiodarone. So sofosbuvir is used in your chronic hepatitis C patients and amiodarone itself a antiarrhythmic. So when you will use them, both of them cause bradycardia, and due to combined bradycardia we avoid them together. The other point is 6-mercaptopurine and azathioprine. So both of them are metabolized by the same enzyme, that is your thiopurine methyl transferase, and hence when you use them together, okay, so we decrease the dose. The other point is adenosine. So in adenosine we have two drugs which can either cause failure or toxicity of adenosine. So theophylline, which is there, which is methylxanthines, they inhibit the adenosine receptor. So when you will inhibit the adenosine receptor, will cause failure of the drug, and the amount of the drug and the effect of the drug will decrease. And the other point is dipyridamole, which inhibits which is a reuptake inhibitor. So it will increase the level of adenosine at the stage, and hence it will cause toxicity. So this is the basis that theophylline causes failure, whereas dipyridamole causes toxicity of adenosine. Adenosine, as you know, is very classically been indicated in treatment of PSVT, okay, after your vagal manures. So it is drug of choice for PSVT. But the other point is adenosine causes bronchospasm, so we avoid it in asthma and COPD patients. And as you know that patients who have asthma or COPD could also be on theophylline. So the drug of choice for patients with asthma or COPD having PSVT is verapamil for two reasons. First, it causes bronchospasm. Second is, if the patient is already on theophylline, then again it will have failure of adenosine. So now the other few important points are, so carbamazepine and lamotrigine. Carbamazepine could be classically used in patients with trigeminal neuralgia or an anti-epileptic patient, an anti-epileptic drug. Also lamotrigine. So patients who have HLA B1502 allele, so they are more predisposed to condition called as Stevens-Johnson syndrome or toxic epidermonecrolysis. So we should ideally check the allele before prescribing these medications. The other drug is abacavir, which is an anti-HIV drug specifically used in children. So all the children who are being started on your abacavir are previously are better screened with HLA B5701 due to the risk of severe hypersensitivity reaction. The other point about very classically seen in this anti-epileptic is bio-inequivalence. So you should the physician always prescribes same brand of phenytoin. So when the patient takes different brands of phenytoin tablets, there is bio-inequivalence. So when you will change the brand, the bioavailability of the drug decreases. So it is advisable that you take the same, or you prescribe the same brand to the patient throughout the course of the treatment. Okay, so in the comments please let us know that which topics you want us to cover, so that in the subsequent videos we'll make the videos on them. Okay, thank you.